Can you actually skip surgery and heal your rotator cuff naturally? Yes, it is completely possible to heal your rotator cuff naturally and avoid having a rotator cuff repair surgery. There is growing medical research that shows that having a rotator cuff repair surgery and going through non-surgical treatment for rotator cuff tear end up giving you the same outcome 6 and even 12 months after. But what are the most important things that you need to do to avoid having a rotator cuff surgery and heal naturally? Here are 7 key things that you need to make sure that you're doing to be successful. Number 1 is don't do anything that hurts. You need to make sure to not add more tension, not do any exercises, not reach in any certain way that makes your shoulder hurt if your rotator cuff injury is hurting right now. Eventually, as you begin to feel better, then movement is encouraged. You actually need to be doing it, but in the right way so that you're not making it worse. Number 2 is be skeptical of medical advice. Realize that the majority of healthcare professionals are trained in helping people with rotator cuff tears through medications and surgery. Even physical therapists who don't deal with medications or surgery tend to specialize in helping people after they've had a rotator cuff repair surgery. So they're not always sure on what to do with helping somebody before so that they can avoid a surgery. Medical research and what is taught in healthcare schools about rotator cuff tears often focuses on using medications and surgery and the time around surgery, like right after often. But healing a rotator cuff tear naturally takes a specialist, so make sure to do your own research when finding the right person to help you. A specialist like myself, a manual physical therapist, tends to be a good option to help you avoid having a rotator cuff surgery. If you want more help from me, make sure to check out the videos down in the description below. There's a link to a playlist called Rotator Cuff Tear Help. Number 3 is avoid resting as a long-term plan. Very often, healthcare professionals will tell people to just rest, and they're not very specific on how to do that or how long to do it, what things to avoid. They just say, rest. And what I think they mean is don't do anything that hurts, don't be too aggressive, but using rest as a long-term plan is not a good idea because eventually you do need to be doing activities and exercise to help your shoulder heal at the root problem so that you're not having a rotator cuff tear again and again later on in life. Number 4 is reaching overhead is eventually necessary. Many healthcare practitioners will tell their rotator cuff patients to avoid doing anything reaching overhead because that tends to be a painful motion. But the thing is, they don't say how long, and they don't teach people how to properly reach overhead because they assume that everybody just knows, but there's actually a science to it. There's certain movement mechanics, there's certain muscles that need to be used to properly reach up overhead. And if you're not doing it correctly, chances are you're going to be overloading the rotator cuff tendons, leading to the rotator cuff tear. Additionally, reaching up overhead is just an important life skill that will give you excellent quality of life as long as you can continue to do it for the rest of your life. And some people, because they don't get told by the doctor when to begin to reach up overhead, they just indefinitely don't reach up overhead, even into later years of life. And that's no way to live. Number 5 is lifting weights is eventually necessary. Very much like reaching up overhead, being able to pick up something of considerable weight for you, whatever's reasonable for you, is absolutely necessary. Healthcare professionals often tell people with rotator cuff tears to not pick up anything heavy. They'll even give them parameters. They'll say like, don't pick up anything more than 5 pounds or 2 pounds, whatever they feel like is right for you. But the fact is that as you heal, you should be able to pick up things that are 2, 5 pounds, 10 pounds, or whatever's appropriate for your size and ability. As your rotator cuff tendon heals all the way, you're able to add more tension to it and strengthen properly, you should be picking up weights up overhead confidently, knowing that your rotator cuff tendon can take it. Number 6 is know what phase of healing you're in. Rotator cuff tendons have to go through the normal phases of healing that the rest of your body goes through, whether it's bone or skin or any other body part. There's certain phases of healing that take you to the point where you're fully healed and that tissue can now do pretty much what it was doing before. It can act normal again. But if you don't allow it to go through the healing processes, then it doesn't heal. And you can't assume that just because you had your rotator cuff injury several months ago or even years ago, that you're in the later phases of healing. If it hurts, you're in an earlier phase, whether you just hurt it recently or it's been months or years. And if it stops hurting, but you're not confident in yourself in doing things with your shoulder, then you're in the middle stages of healing. You're not fully done yet because you need that confidence. It's only when you have full confidence to be able to do everything that you were doing before and be able to strengthen it more that you're fully healed and in the maintenance phase. I have this all mapped out in our program called the Rotator Cuff Tear Recovery Program. You can learn all the details of this program through the link in the description below. And number 7 is age is not the problem. Correcting muscle imbalances is what needs to happen instead. Very often people are led to believe that because they're getting older, because you're in your 40s, 50s, or 60s, that is the reason why you have a rotator cuff tear now. But the fact is, it's just been time in developing muscle imbalances. And as those muscle imbalances are present for longer amounts of time, they tend to affect the rotator cuff tendons more. But regardless of your age, even if you're in your 60s, 70s, or beyond, it's possible to do the right things to correct the muscle imbalances and heal your rotator cuff tendon so that you can avoid having rotator cuff surgery. Even if you've already had a rotator cuff surgery, you should be able to avoid the next one. Most rotator cuff tears are what are called a non-traumatic rotator cuff tear, meaning that there was no accident, that the pain gradually came on. And in this case, you certainly have a muscle imbalance that needs to be corrected. Why else would you get an injury without doing anything abnormal? Now, some rotator cuff injuries are due to a minor trauma, like you picked up something too heavy, you overdid it in the gym, or maybe doing housework, you did something that you don't normally do and that hurt your shoulder. In those cases, you usually do have a muscle imbalance as well that needs to be corrected. It's only in severe accident, severe trauma cases like a car accident, a motorcycle or bike accident, that there's a greater chance that you don't have a muscle imbalance that needs to be corrected. But by and large, most rotator cuff injuries have muscle imbalances that need to be corrected. It's not related to age. It's related to the muscle imbalance. If you can correct that, you'll be just fine. Hey, if this video was helpful for you, please give it a thumbs up. Don't forget to share this with somebody you think needs to hear this, and subscribe to our channel and turn on the notification bell so that you don't miss out on any of the videos that we post each and every week. Thanks so much for watching. I'll see you in the next video. Bye-bye.